C'est avec un immense
Much. It is with great pleasure that I will co-chairing the panel number 4 with the Dr. Richard Nchabi KAMWI, the former Minister of Health in Namibia. The theme is on Africa post-COVID-19. I would like first of all to thank the organizers of this forum, whose aim is to take a stock at the COVID-19 pandemic that has shaken the whole world and whose pessimistic scenario for Africa has been proved wrong. And by the same occasion, same opportunity, we would like to look at the future perspective. I would like to introduce and facilitate the first theme, and then I'll leave the second theme to the minister. It is always difficult to introduce oneself. But briefly, my name is Aminata. I am the president of the High Council of Territorial Communities of Senegal. That is the fourth institution of the Republic of Senegal. I have been appointed to this position since November 2019. I am also at the head of the Socialist Party that is represented in the parliament and in the government by two ministers. In my career, I have had two positions of a minister, the Minister of Women, Family and Children, the Minister of Women and National Solidarity as well. I would define myself as a convinced Pan-Africanist and a militant in women, an activist in women's rights. I will let my co-chair present himself before I introduce the new subject, that is what new health system for an Africa post-COVID-19. Thank you.
Monsieur KAMWI.
Is Mr. KAMWI here? No, he isn't here yet. He hasn't joined us yet. Okay, so if he's not here yet, how do we proceed? I think that you have to introduce your first theme, the first panel, please, and introduce the speakers. So the first theme is, what are the new health systems? Despite the fact that Africa has been quite resilient facing COVID-19 pandemics, according to statistics, uh, the official statistic, of course, it is the second continent the least affected, with more than 15 deaths more than Oceania. We have to understand that it still has a negative impact on our health system, and Africa only represent 4% of the cases. But the pandemic was nevertheless very hard on Africa on every level, with social and economic consequences. In such a world, a globalized world, doctors are shared among all nations, and with international mobility that was slowed down, despite the fact that our economies are linked by exogenous factors, despite the massive investment towards our health systems, the pandemic has highlighted gaps in the management of our health system that we need to question and reassess in the different components. Indeed, the world health system have shown their weaknesses and their precariousness faced by the propagation of the COVID-19 pandemic, and especially in rural areas. The infrastructure did not give the adequate equipment, such as ventilators, beds, thermoflash, PPE, to be able to welcome and take care of patients. Moreover, it was noted that there was a weakness of the medical experience sometimes, and we to be able to strengthen the response capacity. In the same time, the countries were characterized by the in existence of a consensus surrounding the treatment protocol, but also for severe cases. Each country decided to follow their own experience and conviction. From lesson learned, we want to think about the question around the management, the motivation of human resources, the improvement of infrastructure and materials, the in equipment, the monitoring and evaluation, the management of crises, as well as the effectiveness of our efficiency of our health system. Given what has been said, I would like to now introduce Ms. Lucie IMBOUA-NIAVA, you as the WHO resident representative in Senegal. I would like you to introduce our sub-theme, What New Health System? And I would like you to answer to the following question. Many were afraid that COVID-19 would absolutely wreak havoc in Africa due to its precarious health system. Being the representative of the WHO here, what are the lessons learned and some perspective to strengthen the health system and to make it stronger in case of pandemics? Thank you. Thank you very much to you, Mrs. Chairwoman. Mrs. Chairwoman, ladies and gentlemen, ministers, dear guests, I would like to present to you the lessons learned, but also give you some perspective on a post-COVID health system. The president has already introduced me, and she also gave most of the elements of my presentation, but we'll try to still mention it. So I would like to present to you the PowerPoint that I have prepared. I hope that you can all see it, yes? For this presentation, I will talk briefly of the state of our health system prior to the COVID-19 pandemic, the lessons learned from this pandemic, as well as some perspective to have a resilient health system, and then we'll conclude. So what was the state of our health system before the COVID-19 pandemic? We all know that in our countries in Africa, in the WHO African region, Afro region, have a different level. We've seen some issues with governance, leadership, and the management of health systems. We also know that we do not have enough human resources in the health sector, in quality but also in quantity. Sometimes they are concentrated in urban areas, and in remote areas there are not a lot of health agents. There is also insufficient access to essential medicine and other equipment. The care packages are not often available, and when they are available, they are not complete. The reference systems are weak, and there is a discontinuity of basic services during sanitary emergency. The fact that there are not enough resources, human resources, means that when we are facing an emergency, this staff is concentrated for the emergency response, and so we cannot have the delivery of basic services. Also, the quality of health services are not optimal. The sanitary data are available but limited and incomplete and not disaggregated, and their use for decision making is very limited. Finally, the community are not enough engaged, committed to the health issues. When it comes to the health system during the pandemic, we've seen that the shortcomings before the pandemic were just highlighted and exacerbated And this was due to the insufficient level of preparation or preparedness facing sanitary urgencies. We know that we have some basic capacities that countries need to have to be able to prepare themselves to emergencies. And unfortunately, we've seen during this pandemic that the shortcomings were often due to a lack of preparedness. These shortcomings were seen on every pillar of the health system, meaning governance, funding, service delivery, human resources management, and on other pillars such as sanitary data. There was also a very low coordination of response at the uh, infranational level, at the devolved level. In many countries of Africa, response was really focused on the capitals, and the devolution of this response wasn't thought of straight away and implemented straight away. The other sectors weren't enough involved. We've seen in Senegal that we've seen a response where all the sectors were involved. So involving other sectors, the multi-sectoral aspect that we want is what we've seen in countries such as Senegal, but usually they're not really involved, and we've seen a health system that was crumbling under the weight of response when other sectors could have helped together with the health sector. There have also been an over-reliance on hospital centers at the expense of primary care. Only big hospitals were solicited to take care of the cases. We've all seen with the traveling ban, to a lack of supply, and then we've seen the weakness of our supply system. There was also a limited capacity of the use of technologies, and epidemiologists' data did not guide action. Sometimes it was just rumors guiding action, but the data that were collected and that were at our disposal weren't used for decision making. Now, given that, we were able to notice that there was a misunderstanding or a bad interpretation of the international sanitary regulation, as well as all the legal framework of this instrument in every country, whatever the development level. We've seen it in developed countries as well as in developing countries in Africa. So all these observations have been really hard on universal medical coverage. We've seen that some of the assets that were acquired in the past years have been completely lost, and it was necessary to really break the cycle of panicking and being neglectful. I remember that when we were preparing Senegal for the epidemic that became, or the outbreak that became a pandemic, someone, and I don't know if they're present here, but they'll recognize themselves, but someone asked us, why are we so emotional? And I told them we are emotional because after this crisis, we fall asleep. And that's why I'm talking about a cycle that really summarizes what I'm saying. When there is a crisis, people are all working, being active. We are panicked, and so we act with our emotions. But as long as the crisis just goes away, we just become careless until the next crisis, and we do not prepare ourselves, and we just say that, usually we say that the future crisis is prepared during the current crisis. And so we need to rebuild, and the COVID-19 has given us the opportunity to rethink the strengthening of health system and to prepare a better preparedness to emergencies, health emergencies. to be able to have this resilient system. We've talked a lot at length of health system of resilient health system after the Ebola outbreak. But however, or luckily, we've used the lessons learned from Ebola to prepare, and I think that this is what really helped us to answer the actual, the current pandemics. But we need to be able to take advantage of the political will, the political impetus to be able to accelerate this, to transform our health system with a focus on primary health care and the preparedness to future threats. We need to invest on health and beyond, meaning on other sectors, to put into place a collective financing mechanism for individual services based on the population to be free, and so that a certain key element of the health system, such as health data, laboratories, equipment can be funded. We also need to have human resources that are available and able to deal with preparedness and response to emergency while still carrying out primary health care. And we need an increased involvement of the private sector. The private sector has involved itself during this pandemic. It needs to be better involved, as well as communities, so that they can fight against the risk and protect themselves against the threats. When it comes to the resilient health system, we need health services that are integrated and of quality, with an accent that is centered on people, on primary health care, on reference systems at different level of care. We need coordinated mechanism to supply quality medical products, to improve access to medicine and to health technologies. We've observed that there were a shortage in supplies for many months, and this is why we need to develop our pharmaceutical industry at the local level and at the regional level. And this is why we have our regional economic communities that can help us. We also need to strengthen the regulation of medical products as a integrating factors to health system and a facilitator a facility for a facilitator factor for the delivery of service of quality services. The management of risk linked to COVID-19 and other emergency is necessary, and this goes through the strengthening of the main capacities of the international sanitary regulation. As a conclusion, I would like to say that the need for world or regional network, international and regional resilience network is absolutely paramount for our countries. And it is something that everyone knows, that viruses do not respect borders. And this is why we need to develop more cooperation with neighboring countries, and that we need to develop more trans-bordering mechanism. Mastering this international sanitary regulation is also essential, and this calls for a it calls for developing countries to really have enough means to coordinate preparedness. We need to rebuild a devolved health system that is equitable, based on primary health care, and this is how we will be able to have a universal health coverage. I would like to end on these words. If we have a health system that is safe, that is trusted and supported by the whole population and local political leaders, by supplying reliable and high quality services, we can say that it is a resilient system, with or without crisis. Thank you.
Madame la Présidente, je pense que Madame
Mrs.
IMBOUA a terminé.
President, I think that Mrs. IMBOUA is done with her speech.
Allumez votre micro, s'il vous plaît. Merci.
Could you please turn on your mic, Mrs. Chairwoman?
Merci beaucoup à Madame.
Thank you very much to Lucile IMBOUA-NIAVA for the very relevant and precise answers that she's just given us. We've taken good note of the measures that you recommend to take so that we can make our African health systems more stronger and more resilient. Thank you for the very important role that you've played together with the Ministry of Health and Social Action and together with healthcare workers when it comes to our response. I think that the Ebola response has been determining and it has helped us a lot. Thank you very much for everything that she's done and said, and thank you to her team as well. Now I would like to give the floor to the Dr. NKENGASONG, the director of the African Centers for Disease Control and Prevention, Africa CDC. The question that we have for him is the following. The African Union was created. Why and what is its status? What was your role during the COVID-19 pandemic? And what are the health systems that you would recommend for a post-COVID Africa? You have the floor.
Thank you, Excellencies, for the opportunity to contribute and address those three key questions about the creation of the Africa Centers for Disease Control and Prevention, the role it has played, and the post-COVID thinking. First of all, let me start my reflections from where we are with COVID. Not necessarily from the continental statistics, because others have touched on that. We're counting on more than 2 million cases on the continent with 55,000 deaths. But rather, from a scientific standpoint, the admiration that I have for the progress that science have contributed in our fight against COVID-19. Just barely 2 weeks after the COVID virus was identified in Wuhan, the sequences were made available. And from those sequences, diagnostics were developed very quickly, molecular diagnostics. And it is amazing that in under 1 year, vaccines were able to be developed, went through phase 1 trial, phase 2 trial, and phase 3 trials. And as we speak, vaccination have started in some countries. That is remarkable. It speaks to the power of science, innovation, and technology in fighting recent outbreaks and pandemics. So why was the Africa Centers for Disease Control and Prevention created? The Africa CDC, as it is commonly called, was created out of the vision and the wisdom of our head of states. When the Ebola outbreak was ravaging West Africa, it occurred to the leadership of the continent at the levels of the head of states that the continent needed a public health specialized agency that will be owned by the African Union and will be at the disposition of member states. And that would do essentially three things: support member states to respond to pandemics and outbreaks, contribute to strengthen their capacity in the areas of workforce development, and advance research. I started off with a theme of research because without science and research, we will never defeat pandemics. There's a limit to how we can use public health measures, i.e. social distancing, washing of hands, and other measures that we've used in the first phase of this fight. But it is obvious that it will require science and technology in the second phase of this battle against COVID-19. The question as to what is the role, the stature of Africa CDC, it is a specialized technical institution of the African Union. So the Africa CDC is to the African Union as the World Health Organization, the WHO is to the United Nations. Very often, pandemics or disease outbreaks lead to innovation and creation. And I believe strongly that the creation of the Africa CDC was a political innovation of the leadership of the continent, of our head of states, which is often not recognized enough. And that recognition has to be made very clearly that without such vision and wisdom, you will never advance institutions. We at the Africa Centers for Disease Control and Prevention are actually calling for a new public health order for the continent to guarantee our health security. A new public health order that hinges on a couple of factors, recognizing that you cannot mortgage the health security of an entire people, a people of 1.2 billion people, to the externality of the continent. So what do I mean by that? When COVID-19 hit the continent and the first cases were reported on the 14th of February in Egypt, the continent had no laboratories, no country that had the ability to test for COVID-19. And I repeat, at that time, there was no laboratory that could test for COVID-19. Thanks to the partnership and collaboration with the Pasteur Institute in Senegal, the National Institute of Communicable Diseases in South Africa, together with the World Health Organization, we were able to rally countries and train them in Senegal and South Africa and build the capacity of the continent rapidly. Luckily for the continent, we had observed what was happening in China, Europe, and the United States with total shock. And we all under a heavy impression that we needed to quickly put in place diagnostics. However, it would take us several attempts to bring the diagnostics from outside the continent to fortify our defenses. I think we always say this after all pandemics or outbreaks, that never again, but the starting point should be never again should the continent be so deprived of the ability to do and conduct simple diagnostics, as simple as doing a molecular test for COVID-19. The second area that we are watching in total disbelief is our inability as a continent of 1.2 billion people to conduct research that will lead to the production of vaccines on the continent. We are all relying on the externalities in China, Russia, Europe, and the United States to develop vaccines that will be used on the continent of Africa. And I'm here, let me go back to 2009, where during the H1N1 pandemic, the same struggles that we are facing today were also expressed in 2009, where Africa was at the queue, waiting for vaccines or vaccinations to occur in the Grand North, and then the remaining of those vaccines will be used in Africa. The third area is in the area of drugs development. Let me just be very clear with my thinking. We cannot talk of health security of the continent without those three dimensions, i.e. the ability to produce diagnostics locally on the continent, the ability to take part in clinical trials in an innovative way and not wait for vaccines to be imported from outside, and the ability to produce drugs by participating in clinical trials. That segues to the second most important thing we have to do post-COVID, which is a deliberate investment in a public health workforce. We all know that as a continent, we need 6,000 epidemiologists, just for the case of this dialogue. As a continent, we have 1,900 epidemiologists. We have a gap of 4,000 epidemiologists that we need to train. We knew this during the Ebola outbreak in West Africa. The question is, what did we do between the Ebola outbreak in West Africa and the current pandemic? I call those, Madam Chair, the known do-nothing gaps. The gaps that we have known for years, but deliberately not invested in them until COVID-19 has taught us that strengthening those gaps are actually an economic investment. That strengthening those gaps are actually an investment for our national security. And I use the word national security deliberately and bold it and underline it. Madam Chair, I would like to submit that going forward in the spirit of post-COVID-19, we should advocate for the entire continent, for each and every individual member states to have its own national public health institute. That should be able to do 4 things. 1, coordinate a network of surveillance so that we can pick up diseases early and respond to them. 2nd, coordinate a network of laboratories like the Pasteur Institutes in Senegal. 3rdly, focus on workforce development. And 4thly, actually work in new information dynamics, information systems. We live in the 4th industrial revolution where technology will be central in the way we respond to pandemics going forward. Let me just conclude then by saying that we should take also the leadership, the political leadership, recognize what they have done aggressively and with exceptional qualities during this pandemic, but ask them, our leaders, that they should actually invest more in strengthening our health systems and see that as a direct investment in economic growth of our continent. We have seen how a disease, a simple virus can paralyze the entire continental agenda, like our free trade movement that will go operational on the 1st of January. That whole gigantic movement that is so critical for our development, we don't have strong investment into our public health systems. Charity begins at home, Madam Chair. So rather than look always outside the continent for financing our health needs, we should begin to actually meet the quota that we agreed in Abuja, Nigeria in 2002 to contribute up to 15% of our GDP into our health systems. I thank you for the opportunity.
Madame la Présidente, Monsieur KENGASONG a terminé et votre co-chair, Monsieur KAMWI, nous a rejoint.
Madam Chair, Dr. NKENGASONG has finished his presentation. Thank you very much, Dr. NKENGASONG. The responses which you have given have met the questions which were asked. We are indeed edified with the mission and role of CDC Africa, which is a consultative and technical organ. Your presentation has indeed shown the relevance which leads to the taking of quick decisions and to deal with health issues. I believe that the African Union will draw lessons and will make an effort to place sufficient resources at the disposal of the CDC and to help public health so that this could indeed become a reality. And we have also understood, choose the English language if you are listening in English, so that African countries will be able to deal with this to avoid such cases in future. So I would like to thank you. And now I'll open the floor for discussions. Those who feel like making comments, who seek clarifications, or who have proposals to make should feel free to do so. Please, if you're listening in English, click on English. You have to choose your language. Thank you. So is there anyone seeking the floor? If you're seeking the floor, please indicate.
Public, nous avons Monsieur Raoul Nyandiaye qui demande la parole.
Am I seeing one?
There is someone seeking to take the floor.
Merci.
Raoul, you have the floor. Thank you, Honorable Chair. I would also like to thank the members of the panel. And my presentation, I noticed that investments required to cater for this issue of crisis notably in the health sector, within a short period would require that we try to deal with it from local councils, which will be in charge of health coverage and at least at the divisional level. To that end, we need to verify whether in our local councils we have the necessary tools for prevention, management, and education in a crisis period, and especially in a crisis period. So we should try to see how we can organize ourselves and react as required when this happens. And as Madam Uya was saying, it will be necessary for the response or the preventive measures should not be punctual, but they should be sustainable. In other words, when we have preventive and management measures at all levels, especially in the local councils, we'll be able to strengthen our efforts. So the last thing I would want to say is, I would like to refer to the fact that the city and the government in 24 made efforts. So now, efforts should be made to set up programs, management programs to deal with this pandemic and to make focus to see how local councils and even beyond the states could coordinate the activities in the fight against the pandemic. Thank you very much.
There is a place where it's written interpretation.
Yes, then you'll see French, English. Then you click on it, then you'll see French, English will appear. And if you want to listen in English, you click on English. And if you want to listen in French, you click on French. Madam Chair, for now, there's no one else seeking to take the floor. We'll now give the floor to someone else. So would like to call on Dr. NKENGASONG to respond to the question asked.
Monsieur Kengasong, vous pouvez répondre à cette première question.
Dr. NKENGASONG, could you kindly respond to the first question that was asked?
There's a delay, but let me check on that. I think to respond to the first question, I think we have to
Docteur, votre micro est ouvert.
C'est ouvert. Vous m'entendez? Allô? Allô?
Apportez des... Oui? Voilà, merci. Vous voudrez prendre la parole?
Vous m'entendez?
Docteur, est-ce que vous pouvez répondre à cette première question qui a été posée par M. Raoul Ndiaye?
I'm not sure if you're hearing me.
Moi, je vous entends.
Yeah, so anyway, I was saying from the question, and it was that my point of view is that we really need to have the interest of our security, the collectivity in our approach. I think we, over the years, we know what we need to do.
Docteur Nkengasong,
So anyway, I was saying,
les traducteurs ne vous entendent pas. C'est un problème de connexion.
can you hear me?
Mais c'est à quel niveau?
Hello? Hello?
Les autres, ouais, c'est dommage. Mais à quel niveau ça peut se régler?
C'est au niveau de M. Nkengasong, hein, Madame la Présidente. Il y a Madame Lucile Imboua qui demande la parole.
Voilà, Lucile, vous avez la parole.
Merci, Madame la Présidente. Je vais essayer
Lucile,
de...
you have the floor. Madam Chair, I believe that in regard to local councils, I believe that when we started the response to the crisis, there was the issue of local councils which came up. And I believe that within the purview of the multi-sectoral nature of centralization, local councils were supposed to be given a pride of place in this fight against the pandemic. With regard to the management tools, there are tools which were at the level of the districts and the regions. And the management, the multi-sectoral management at the level of the district or the section must involve local councils and involve them in the use of these tools. I think that was a lesson that was drawn from this pandemic, and that local councils should be involved. And we have retained your suggestion as a rapid management program for a response involving the local councils. At the level of the United Nations, when we were holding our coordination meetings, you are aware that the agencies have different heads, and quite often we try to see what we could do with local councils. We suggested, for instance, that local councils should be kept responsible for all interventions which were related to communication risk in order to involve community engagement, community commitment, and there are other aspects where local councils could contribute in the fight against the pandemic. So I believe that the idea of the program to involve local councils is what I've retained, and which I believe is very important. Thank you.
Votre micro est fermé, Madame la Présidente.
Unmute your microphone, Madam. I was saying that local councils in Senegal played an important role in sensitizing the people and in the participation of the community. I can take the example of Bajenno, animators at the local level who sensitize the population to a very great extent on all the different issues raised, and particularly on these restrictive measures. And local councils also participated in buying products such as detergents, face masks, and all other things which were needed. So if we take the example of schools, before classes opened, a lot of investment was carried out to enable the people to have the necessary minimum needs to be able to carry out the activities. And we had things like detergents, basins to be able to wash their hands, and especially the availability of water in schools and in the quarters. Thank you, Mr. DIOUF. We'll give the floor to Mr. DIOUF, the president of the department in Senegal. Okay, Mr. Adama, you have the floor.
Adama?
Okay. Mr. Adama? It is indeed with a real pleasure that I accept this invitation. First of all, it is indeed an honor for me to have been chosen for an activity which is very important, and especially under the auspices of the president. We have lost the speaker. The interpreter has lost the speaker. There's a network problem.
Madame la Présidente, je vous propose de passer à la deuxième partie
Madam Chair, I would suggest that you move on to the second part of the session, please. We're just 45 minutes away from the end of the session. There's Mr. KAMWI, your co-chair, who is Dr. NKENGASONG. I would like to thank all those who have contributed. We have learned a lot from the crisis. We've had a lot of new ideas on how to make our health systems more resilient from the external and internal perspectives. Now I'll give the floor to my co-chair who will coordinate the discussions for the second sub-team. We cannot hear the speaker. So I'll hand the floor over to the second moderator for the second sub-team.
Hello.
Mr. KAMWI, please, you have the floor.
Yes.
Je vous passe
Good
le
evening. Good evening. Thank you very much indeed, Commoner. Let me first use the opportunity to thank the organizers for having given me the opportunity to be part of this very important session. Africa post-COVID-19. I want second to extend my sincere apology. I arrived on time, but challenges related to network that I could not go through. Can you hear me? Hello, can you hear me? Oh my good Lord.
Yes.
Thank you.
Yes, we can hear you. Yes, we can hear you.
Your mic is off.
Kindly unmute your microphone, sir. Kindly unmute your microphone.
Yes, I have done that. I'm saying I missed the first part so much that I do not know exactly where we are. May my co-moderator please assist. Where are we? When I joined the floor, Dr. NKENGASONG was talking, presenting.
Voilà, donc nous en sommes numéro 2.
We are in the second sub-team, Intersectorality, One Health, and Decentralization. So you'll have to be the moderator from now, and there will be two speakers, Dr. Adjaratou NDIAYE and Professor Stanley OKOLO. So you have the floor, and you'll have to invite the panelists.
Okay, thank you very much indeed. If now I understand, may I take this opportunity to welcome our speakers. Let me, without wasting time, invite Dr. Adjaratou NDIAYE, representative of Platform One Health Senegal. I have a question for you, and the question is, the notion of One Health has been decisive in the fight against the virus, and today against COVID-19. You share with us the implementation of the approach and the future, and please, over to you.
Hello, everybody. Thank you very much to give me the floor. And I want to speak in French, if it is possible. And I hope you have a translation, Mr. President.
Yes, you are most welcome. You are most welcome.
Thank you very much. Oh, okay.
I have been asked to talk about intersectorality in Senegal and how this approach contributed in the response to the COVID-19. Permit me to extend my greetings to the co-chair, who is a champion in this fight in Senegal. And throughout, whenever she took the floor, we saw her commitment in the sectoral fight in Senegal against this pandemic. Madam Chair, you have worked a great deal, and we appreciate your approach. So we want to congratulate you. You'll agree with me that we all have a lot of pleasure to work with you in this area, presided over by our great professor. So we have learned a lot of lessons through Professor Eva Marie Kosek and others for whom we have a lot of respect. And I too think that you are both champions. Now, very quickly, my presentation will be in 4 parts. 1, we're going to talk about the constitutional framework in Senegal, how Senegal set up this constitutional framework. Secondly, we're going to slightly discuss and share with you funding of this pandemic, which is one of the multi-sectorial strategy, and here how Senegal had funding. Then we talked about implementation, as Madam, the representative of the WHO, said, how Senegal succeeded in this multi-sectoral approach. And lastly, we'll talk about some of the lessons learned, but also the challenges which we face here in Senegal. Now, for the institutional framework, I think it is with the beginning of the pandemic all over the world, but also the Ebola response. All of this was characterized by tripartite cooperation: the WHO, the FAO, the AU, and 70% of human diseases come from diseases through the hand. So we try to look at a global approach, and we ended up with human health, environmental health, and animal health. So security was indeed a very important approach here in Senegal. All health security programs were indeed taken on board, and Senegal also had a lot to benefit from. There was one of the first countries to benefit from the Global Health Authority with American support. All this with the United Nations system, the World Bank contributed. So very early, therefore, the authorities in this country understood the stakes of this global health approach, and this indeed helped us a great deal. It contributed also to the success of the Senegalese story. In that regard, therefore, there's an institutional framework which specifically comprises the management of COVID with a supra-strategic level comprising two levels: the presidential level, as I said a while ago at the beginning of my speech, with an interministerial high-level meeting presided by His Excellency, the President of the Republic, with representatives from sectoral ministries, but also the high-level senior officers of the army, the university dons, and researchers. So we really had to start our response very early, and this interministerial committee was set up and presided over by the head of state, and it showed that leadership was at the highest level. At the supra-strategic level, which was another level, there was another situation. At the level of the Secretarial General of the government, there was a pilot committee of the High Council of the National Health Security Council. There was representation, which was strategic, that's sectoral secretaries general and local councils. We'll come back to that in a short while. And this was indeed extraordinary, the role played by these local councils. But there were also the university researchers and professors. So these two levels were completely multi-sectoral. And this term
de sécurité sanitaire mondiale qui montre toute la définition que nous avons, sécurité sanitaire mondiale, en mettant l'accent sur l'enjeu planétaire de ces crises. Alors, toujours dans le cadre institutionnel, nous avons mis en place aussi le cadre existé, mais dans la gestion de riposte COVID aussi.
In the management of COVID, we have been able to really implement this framework with a lot of room for improvement, of course. And the second level is the sectoral level. In this management of the COVID-19 pandemic, we've had the Ministry of Health first, in a way, the master of this implementation, then the economy minister. Then we had the sectoral focal point of the One Health initiative that have participated to all the meetings of the National Committee of Outbreaks Management. And to that committee, we also have in this committee, we also have technical committees through the PCI, the laboratories, the CREC, the community involvement, the logistical and funding aspect as well. These different committees have been working from the onset of the crisis in China, even before March, when it happened in Senegal. This committee was triggered with a preparation of our preparedness phase, a preparedness plan with a multi-sectoral approach, of course, with the involvement of all sectors. We also have a cell that is a multi-sectoral entity as well that met every day with most of the sectors present, fishing sector, the security and defense forces, the environment, all were members of these two committees, this committee and this cell that were within the Ministry of Health. What we've had in other sectors, and maybe this will be the point that really highlight the multi-sectoral approach that was adopted in Senegal, we can say that in every sector, there was a crisis cell that was set up, multidisciplinary, meaning that each minister has set up a committee with the onset of the crisis, with all the directorate of the ministry with different functions to really deal with the crisis in a multi-sectoral way, in link with our multi-sectoral committee. This also has been life-saving to see the leadership that was within the hand of our ministries that have set up crisis cell. I've had the opportunity of participating in some of these meetings. It was either the minister or his secretary that would really lead these meetings with a very thorough analysis. We've also organization, civil society organization in any form, from NGOs, the diaspora that mobilized as well. We've had a lot of associative movement. Mrs. the Ministers, our chairwoman have talked about it as well. All association within the communities were really committed to have an effective commitment in the response. And even if the most remote areas of Senegal, all organization of the civil societies that committed, that mobilized resources, their force, their and efforts, and identify strategy. And I think that this explains the success of Senegal. We also have the private sector, the Senegalese private sector. We would like to really congratulate them. We've had a private sector that really committed from the beginning with a fundraising from just small business owners to banks and big companies, whether in their CSE or just because they're committed to the national effort. They came, gave us resources. I've seen in certain hospitals that there were donations from the private sector. This was also the case in the Ministry of Health, with the private sector adding value, helping the response. We've also had a particular feature in Senegal. We said that all the sectors were mobilized in other countries as well, but as the representative of the WHO said, we are one of the countries that really had a multi-sectoral approach that was very efficient. We've had community commitment platform, community engagement platform rather. I think that 2 days ago, the Professor Nyon had mentioned this process of community engagement that was really the key, one of the keys to success of Senegal with this process. We haven't defined the strategies ourselves. No, it's the community that listened to us, that is sensitized, and that is defining the adequate strategies for the community. So it has been through consultative process that we were able to look at how to really put things into place. We've been listening to them, they have been listening to us, and this is how we found strategies. And I think about health safety, and I think that this is a strategy that we will implement in the future, not identify strategies ourselves and then apply it in the community. No, we co-build strategies with the communities, and I think that we've had a lot of good results. I will not go over the time. I think that our master has already shared it, my mentor, Mr. Nyon. So now also one of the aspects that was special here is the peripheral side that has played a very important role, and we'll talk about it in our challenges. We've had a peripheral management of response throughout the countries, the 14 regions of Senegal, with each their regional community to manage outbreaks. They were able to manage our response with a multi-sectoral approach, really. Given that the committee were multidisciplinary themselves, the idea was to lead it by governors, for example. This was also a devolved strategy of our response. We've also had a certain number of associations that have mobilized, whether in small communities, in villages, or in the regional level, at the regional level, to have a better adapted response for them. because we all know that the Department of Dakar can be different from the Department of Linguère, where I'm from. So in a nutshell, this was the institutional framework. The second element, of course, is funding. I think that one of the main challenges was funding. Senegal was lucky enough to have a multi-sectoral funding, as I've said. This funding was already put into place quickly. The highest authority of the country understood the stakes of this crisis and put into place a fund with the COVID-19 fund where many sectors benefited from the tertiary sector, the defense and security forces, the craftsmanship industries. 1,000 billion were put on the table to fund the multi-sectoral approaches. But we also have a particular feature here because the leadership of the ministers meant that most of our ministers used their own budget to fund the response, given the different sectoral intervention. So we would like to really congratulate them for using their own budget in the response. We will not forget our technical and financial partners that have also participated and funded some sectors directly. So here is another component of the multi-sectoral approach is funding. Now I would like to talk about the implementation framework. I think that the implementation framework has a central devolve level and also the community engagement platform. I think that maybe we should talk about funding more these platforms.
Excuse me.
We've had.
Excuse me. If you can kindly wrap up, Doctor. You have said so much, but I am afraid we are running out of time. If you may
I don't know my
kindly
time.
It was,
I
said
my
it
time.
was 5 minutes. It was 5
Okay,
minutes.
in 5 minutes I'm finished.
Yes, please, because we have
Okay.
to allow another speaker. Thank you.
Thank you very much.
Over to you.
Okay, et on avait aussi les collectivités territoriales.
So we also had territorial communities. As the president, the chairwoman has said, we have elected officials and mayors that have done so much. Water, sanitation, preventative measures. I think that they were really affected by the crisis, but they've pulled through for their community, the territories asking for aids. They've done so much by buying equipment, for example. So elected officials have really shown the way. And I think that they've played quite a role in the management of this response. And finally, we have universities and research institutes that have played their role perfectly, especially for innovation. Many innovations. I've always said that we've faced a lot of death, is true, but it was also the opportunity to really understand that ourselves, in our countries, we can count on ourselves. And we can see that we are quite innovative, and I believe that it is a high time to build our capacities. We also have the defense and security forces that have played quite a role in making our borders safe, on following the cases, the logistical aspects as well. We've seen army trucks that were giving food packages, learning at a distance, the respect of health protocol, sanitary protocol, maintaining exams with innovative strategies, which means that we haven't lost a year, an academic year. Transport and the restriction on transport, tourism, some hotel were used as a quarantine site, trade. There were zero shortage of basic food elements, foodstuff. The industry with the use of the respect of norms when manufacturing hydraulic gel, the Department of Justice funding with the crafts All these measures are.
Excuse me, I'm finished.
I really have a please. We need to listen from Professor Stanley OKOLO.
Thank you
We
very
are
much.
only 17 minutes. I want to thank you sincerely, Dr. NDIAYE. Your presentation really focused on, lessons learned from the quality leadership in Senegal, from His Excellency, the cabinet ministers, and I want to cite here my dear sister, Professor Awamar Kolsek. The leadership is where you are. We admire you, since that of COVID-19 in February, Senegal has demonstrated quality leadership in terms of decentralization on One Health and bringing all the community working together with government. And that is the way to go. For now, permit me to invite Professor Stanley OKOLO, Director General of WAHO, who is based in Burkina Faso. And yours is a kindly summarize on this question. WAHO has greatly helped the ECOWAS countries during the management of the COVID pandemic, including support in drugs and materials, procedures for opening air borders, strengthening of laboratories and epidemiological surveillance. Can you take stock of what all this entails post-COVID-19? Over to you, Prof. OKOLO?
Thank you very much. Thank you very much, and good to see you again, Dr. KAMWI. I think we last met in Geneva at WHO 2 years ago, and extremely grateful, Professor Awasek for inviting me, ma'am. I think we met in Togo, and how did we know when we were meeting in October 2019 that we were going to be faced for the whole of 2020 with, or rather in January 2020, that we're going to be faced with this COVID issue. Now, I know I have 5 minutes, and I'll try as much as possible to speak for 5 minutes. Now, the issues have all been covered by several people, and thank you, John NKENGASONG, who I think may have logged off. He was having computer issues, but John has already talked about the coordination, collaboration, and communication that we have in Africa. West Africa Health Organization, supporting the 15 countries of West Africa, was the first region in Africa to set up a ministerial coordination meeting to try and adopt a regional approach. And we did that on the 14th of February, ever before we had our first case in West Africa on the 27th of February. Whilst we are meeting in Bamako, the first case in the whole of Africa was declared in Egypt. Now, we have had certain challenges, and we have had certain, let's say, results. But in my 5 minutes, I will just want to concentrate on these challenges that I think actually in themselves could present challenges, but also be prospects for the future as it relates to health systems. So I would like to concentrate mainly on capacity. And when I talk about capacity, I will talk about human capacity, the infrastructure, and the challenges we had with surge capacity in the region and across the 15 countries. I would like to talk a bit about technology. And when I talk about technology, I'm really looking at the issue of both laboratory, but also what we gained from technology, where we lacked it, and how we were able to gain from it. And then I would like to talk about leadership and governance. And here we're talking about the multi-sectoral nature that we had in a lot of our countries and how it worked through some of the technical things we had. So let's start. The first instance is that the disease surveillance architecture that was set up in West Africa post-Ebola made us be in a better position to confront COVID-19 than we were when Ebola hit. Ebola was only 3 countries, maybe you add Nigeria, but the pandemic were all our 15 countries. However, what John was talking about, the National Public Health Institutes, we already have in all our 15 countries. And so that was really the strength of the national efforts, which WAHO was only privileged to be coordinating, supporting, and also ensuring there is communication. Now, within it, of course, John has already outlined the 4 aspects of it: the surveillance, the workforce and research, the laboratory, and of course, in terms of going forward, how we bring together information systems. Now, let me go on to capacity. We found that there was a need, even Senegal that we're talking about, which is one of our stars in terms of country responses. Senegal at some point had difficulty generating sufficient public health personnel for supporting contact tracing and things like that. And one of the things we tried to do using technology was to actually develop training, online training, that made that we were able to support countries where sometimes something like Senegal, we can give funds for them to release some of the public health personnel that were not in the public sector to support the public sector response because people couldn't travel because of closed borders. In other countries, that wasn't enough. And so what we had to do from WAHO regionally was to try and train people. And we trained up over 3,000 support personnel across the 15 countries through about 20 or 25 online things. Now, so that is the challenge and how we dealt with that challenge. The other aspect of capacity that was an issue was, of course, as you have mentioned, the issue of infrastructure. But let's talk about that infrastructure a little bit, where it means the technology we use regarding communication. Some of our countries, or all our countries, have a platform which is the DHIS for Health Information System, and it's now in DHIS 2. But actually, it's not two-way. It is often for dumping information, whereas 2 of our countries, Nigeria and Ghana, to some degree, not really fully, utilized technology software called SOMAS. Ghana is going to be pulled up, and that was really helpful in bringing the emergency operating centers on board, in having a 2-way communication, both surveillance and management. And that's something we would like to push forward. And then finally, in terms of technology, as we open our borders, some of the challenges is how do we ensure the integrity of pre-travel COVID-19 tests? And what we are now doing is to bring all through an Africa Union approved program. We are trying to pilot in West Africa, how do we get technology to digitize all our laboratory tests for travel, so that at the time you're arriving at any border, be it air, sea, or land border, through barcodes, we will know where you had that test, and we will know whether it's genuine or not, and we can easily. And these are things that we're rolling out in the next 1 or 2 months. What has this done for us as a prospect? The whole disruption of the global supply chain has challenged us in West Africa. And some of the things we've been doing before, we have now accelerated. Pharmaceuticals, manufacture of diagnostics, manufacture of vaccines. The Institut Pasteur Dakar at the moment is producing some rapid diagnostic tests. WAHO has engaged with them and engaged strongly to make sure that this is available to our countries. We are now engaging in how we support manufacturers of pharmaceuticals through the ECOWAS Bank for Industrial Development. And the final thing, which is where I end my 5 minutes, is in the terms of public confidence. I am very delighted to hear from Dr. Ngao, who spoke last, about how they use community engagement in Senegal. And I'm absolutely clear that the benefits of that, for example, when Senegal had started having some community transmission in March, for the first time, I understand that at the religious area where there were some of these were happening, the president engaged with them and they postponed the religious festival that could have been a super spreader event. You know, that really is where we have public engagement. The challenge we have now is that as we open our borders, if we don't reduce the cost of pre-travel tests or arrival tests, if we leave it as it's happening at the moment, in some countries up to $150, in some countries $50, the public will become dissatisfied because they would think that COVID-19 now has become commercialized. And that is why it's really vitally important that we don't lose public confidence in terms of continuing with some of the efforts we're doing to open up our economy. We're going to have COVID for the long term, and that is really what we're trying to do to ensure that we take the people with us. So that is where I end, but just to say finally that the things we have learned is that with public confidence, with the commitment of all countries, the issue of sovereignty versus regional support for each other, we were able to get beyond that in West Africa. And I'm really extremely proud and proud of the actions of all the countries, but also grateful to the leaders from the heads of states who set up even a COVID ministerial coordinating committee themselves with President Muhammadu Buhari as the champion, and the ministers of health, who we have a WhatsApp group, we constantly talk to each other, and countries have agreed sometimes when stocks are low in a regional distribution warehouse, we take from one country to the other and then replace. That is the essence of solidarity. And I really say, may that live long. Thank you very much. I hope I haven't taken too much of your time. Thank you.